I'm Tatiana Rundek, Director of the Evelyn F. McKnight Brain Institute at the University of Miami, one of the only 4 institutes in the country funded by the gift from McKnight Brain Research Foundation. We are dedicated to uniting a diverse teams of scientists and clinicians to drive a cutting-edge research on age-related memory loss and cognitive impairment. We hope you'll find these talks informative and inspiring.
Good morning. I'm Dr. Kaur and from the University of Miami, and today we're going to talk about mindfulness. I'm going to talk a little bit about what mindfulness is and go over some of the literature on brain changes that happen during mindfulness. And after that, I'll lead you in a short mindfulness experience. What is mindfulness? So mindfulness means paying attention in a particular way. Mindfulness is a practice that actually dates back centuries ago. It's rooted in ancient Eastern philosophy that gained popularity in the U.S. in the 1990s, largely through the work of Jon Kabat-Zinn. Really, it refers to focusing on the present, living in the present moment, and non-judgmentally. I'll go into that in a lot of detail, in a little bit more detail later on. If you think about the mind, there are 2 modes in which the mind can be. We can be thinking, we can be being, or we can be doing. So the doing mode of the mind is sort of the default setting of a lot of people. It really is when the mind is focused on a goal that is coming up. It can be a simple goal like making dinner, or a really, really difficult goal like flying to the moon. Those are all goals that the mind is thinking about. From a psychological perspective, we have goals too. Every day your goal could be to be happy, or not make any mistakes, not get angry, which are goals that sometimes if we don't meet these goals, we can put ourselves in a lot of distress. Now, on the other side of the coin, the being mode of the mind refers to just being in the present and soaking up everything that you're experiencing in that particular moment. The doing mode of the mind, because of the goal-centric approach to it, really has a lot to do with the future, whereas the being mode of the mind has more to do with the present moment. So if you think of a fish tank, right? The fish that are swimming around the tank are in the doing mode of the mind. They have a goal, they're swimming, and they're thinking about all the things that they need to do, the obstacles they need to get around, as opposed to the plants that are in the fish tank that they're not really thinking about anything. They're just in the present, soaking up the sunlight and growing. Now, advocates of mindfulness have proposed two components of the definition of mindfulness. The first one being attention to the present moment and the present experience, the being mode of the mind. And the second really, really important part of mindfulness is non-judgmentalness. So culturally just accepting and being curious about thoughts that come in and come out of your mind. How do we practice mindfulness? So there are many ways in which we can do it. Some of the more common formal mindfulness practices involve focusing your breathing, which is what I'm going to do later on during our exercise. I'm focusing on the sensation of breathing because we're all breathing pretty much as long as we're alive. For the most part, we're breathing. A body scan is also very popular. That's when you relax and you focus your attention on different parts of your body, usually from the top of your head to the bottom of your feet. There are also movement-based mindfulness practices. So walking meditations are things that people do when you walk around in a forest or you walk around in a field or really anywhere in quiet, just noticing things that are around you without generating thoughts about what's going on. Also, you can do practices like yoga, tai chi, and qigong are also ways in which mindfulness is incorporated into movements. The mind wandering is something that has been really considered in relation to mindfulness. A lot of the times, when we're sitting still and we're being quiet, our mind tends to wander to a lot of different things. What do we need to do for dinner? What's our next task? Sometimes we have random thoughts popping into our head. Research has shown that about 50% of our thoughts, in some cases, during waking moments, can be just spontaneously generated and are unrelated to the task at hand. A lot of people think that mind wandering and mindfulness are a dichotomy. They're sort of two different ends of a spectrum. But really, you do have a lot of mind wandering within a mindfulness practice as well, because it's a natural thing that happens. So we can often hop in and out of mindfulness versus a mind wandering state. The important part when we're practicing our mindfulness is going to be to non-judgmentally accept that mind wandering and slowly bring our attention back to what we were doing. So there is a lot of research on mindfulness. It's a really, really hot topic in the area of psychology and medicine. Focused mindfulness practice has been shown to be really, really effective in a lot of psychiatric disorders, primarily depression and anxiety, but others as well. In individuals who are experiencing chronic pain, mindfulness practice not only reduces symptoms of depression, but is also associated with reductions in subjective experience of pain. In individuals with neurological conditions such as stroke, traumatic brain injuries, which is a stroke is a traumatic brain injury, and multiple sclerosis, where you may be experiencing a lot of fatigue, there's a moderate effect of relieving fatigue by incorporating a regular mindfulness practice. Mindfulness is also associated with improvements in sleep quality. In fact, there's a lot of work coming out of Northwestern and other institutions that look at mindfulness practice and mindfulness-based interventions as a treatment for insomnia. And it's also associated with improved thinking skills. Now, how do all these changes happen? That's through a process known as neuroplasticity. Neuroplasticity is the ability of a brain to change its structure and function in response to experience. So a lot of the time, when we're really young, when we're kids, when we're young adults, we tend to have more neuroplasticity. So that explains how when kids sometimes have certain brain disorders, they're able to function just fine. Or they're able to their brain is able to reorganize function in a way that they're still able to achieve just as much as they could have before. As we get older, this neuroplasticity level goes down, and our brain is less able to form new connections in order to change its function or reorganize different functions in response to insults such as a stroke or a head injury. However, mindfulness can increase levels of neuroplasticity in the brain. So one of the main mechanisms of change is through changing some of the chemical compositions of the brain. So in a regular mindfulness practice of about 10 minutes a day can be shown to increase levels of really important chemicals like GABA and serotonin, and reducing chemicals such as norepinephrine, which are strongly associated with stress. And stress is a strong predictor of changes in the brain in terms on both functional imaging studies as well as structural imaging studies. Mindfulness practice has also been shown to be associated with neurogenesis, so the growing of new neurons in the hippocampus as well as parts of the cerebral cortex, which leads to improvements in attention, processing speed, and other areas of cognition. So mindfulness is, by reducing stress, mindfulness also is associated with reductions in levels of cholesterol, hypertension, and inflammation, both in the body and in the brain. And emotionally, you have decreases in levels of anxiety and depression, as well as stress. When you think about cognitive aging, so cognitive aging refers to your ability to think, your ability to process information as you get older. Mindfulness is associated with changes in a lot of aspects of cognition. So, for example, you're better able to pay attention if you're able to be mindfully in the moment, right? Executive functioning, which is a fancy way of saying problem solving, or controlling your behavior, controlling your thoughts. That's something that gets much, much stronger with mindfulness practice. Memory is something that is also very, very strongly affected through some of the brain changes that we talked about earlier. Ability to speak fluently and clearly. Your speed of being able to understand what's going on and able to react to the world around you. As well as your mood, which affects your ability to think in ways that we don't often think about. You know, when you're sad and you're stressed out, it's very, very difficult to think clearly. One of the main advantages of mindfulness is that it's relatively benign. There is some research that shows that in individuals with anxiety, panic disorder, it is better to do mindfulness with the help of a therapist or a trained practitioner who's able to help you through any anxious thoughts that may come up during your mindfulness practice. It is relatively low cost, and it's amenable for both group and individual instruction. Now, that's a big one because when patients want to get access to doctors, there's often a mismatch between the number of providers that are able to provide mindfulness interventions as opposed to number of people that need it and want it. But the fact that it's amenable to group interventions is good because you can see more people at once. It's also really appropriate for most level of cognitive ability with some modifications. So you would probably, if you're having problems with memory, if you're having a brain injury, you would probably need to work on your mindfulness with the help of a trained professional, but it's something that can be done. And a lot of non-pharmacological interventions are actually difficult to implement in people who already have some sort of cognitive impairment. Self-compassion is another offshoot of mindfulness that was really, really popularized at the University of Texas at Austin. The work of Dr. Kirsten Neff in particular talks about self-compassion quite a bit. So it really talks about the concept of self-compassion involves using mindfulness to turn our compassion and our kindness inwards. A lot of people, a lot of women in particular, although men too, we tend to offer more grace and encouragement and support to our loved ones who are dealing with challenges while expecting the world of ourselves. This can lead to higher levels of stress, difficulties coping, and difficulties managing the challenges day to day. So going through self-compassion exercises can actually help improve resilience and coping skills. So I'm going to lead you in a quick mindfulness exercise right now. I want you to start by settling into a comfortable position and allow your eyes to close or keep them open with a softened gaze. Begin by taking several long, slow, and deep breaths, breathing in fully and exhaling fully. Breathe in through your nose and out through your nose or mouth. Allow your breath to find its own natural rhythm. Bring your full attention to noticing each in-breath as it enters your nostrils, travels down to your lungs, and causes your belly to expand. And notice each out-breath as your belly contracts and air moves through your lungs, back up through the nostrils or mouth. Invite your full attention to flow with your breath. Notice how the inhale is different from the exhale. You may experience the air as cool when it enters your nose and warm as you exhale. As you turn more deeply inward, begin to let go of the noises around you. If you are distracted by sounds in the room, simply notice them and then bring your attention back to your breath. Breathe as you breathe, not striving to change anything about your breath. Don't try to control your breathing in any way. Observe and accept your experience in the moment without judgment, paying attention to each inhale and each exhale. If your mind wanders to thoughts, plans, or problems, simply notice your mind wandering. Watch the thought as it enters your awareness as neutrally as possible. Then practice letting go of the thought as if it were a leaf floating down a stream. In your mind, place each thought that arises on a leaf and watch it as it floats out of sight down the stream. Then bring your attention back to your breath. Your breath is an anchor that you can return to over and over again when you become distracted by thoughts. Notice when your mind has wandered. Observe the types of thoughts that hook or distract you. Noticing is the richest part of learning. With this knowledge, you can strengthen your ability to detach from thoughts and mindfully focus your awareness back on the qualities of your breath. Practice coming home to the breathing with your full attention, watching the gentle rise of your stomach on the in-breath and the relaxing letting go on the out-breath. Allow yourself to be completely with your breath as it flows in and out. You might become distracted by pain or discomfort in the body, or itching sensations that draw your attention away from the breath. You may also notice feelings arising, perhaps sadness or frustration. Acknowledge whatever comes up, including thoughts about your experience. Simply notice where your mind went without judging it, pushing it away, clinging to it, or wishing it were different. And refocus your mind and attention back to breathing. Breathe in and breathe out. Follow the air all the way in and all the way out. Mindfully be present moment by moment with your breath. If your mind wanders away from your breath, just notice it without judging, be it a thought, emotion, or sensation that hooks your attention, and gently guide your awareness back to breathing. As this practice comes to an end, slowly allow your attention to expand. Notice your entire body and beyond your body to the room that you're in. When you're ready, open your eyes and come back fully alert and awake. Set your intention to use this practice throughout your day to help you cultivate and strengthen your attention. I'm going to sign off by providing you with some resources that you can look at home, as well as some websites that you can go to and some books. So some of the better books are 10% Happier is both a book and a podcast that is highly, highly recommended in order to slowly build up your mindfulness practice day to day. Also, PalouseMindfulness.com has a free 8-week course that's available in both English and Spanish for people that want to start on their mindfulness journeys. Apps such as Calm and Headspace have both free and paid options for you to be able to download onto your phones and practice mindfulness on your own time. as little as 10 minutes a day can make a big difference in terms of both your brain health as well as your emotional well-being. So I highly encourage you to go out there and try it. It's not easy to get started, but like anything worth doing, not giving up is going to be really, really helpful for you.
Thank you for watching. Thank you to all the participants who have come to our lectures. Thank you to our partners. And most of all, thank you to our sponsors. See you next time. Keep aging like a pro.